Hey everybody, this is Laura. I just want to go over what's happening next week in lab very quickly. We have got two activities that are going to happen. One is going to be a high fidelity simulation of a pediatric patient in shock. And then the other thing is going to be kind of an open lab concept where they can practice skills. So the simulation, which is in the module, is just, we've got a 1 hour time slot for that. It will run just like all of our other simulations. Um, and then the open lab is going to be in 4502. Um, and we're going to have set up several different things. They're going to have IV pumps that they can play with and some primary and secondary um, fluids that they can, practice programming into the pumps. They're going to have rescue breathing that they can practice. They're going to have sterile technique with the trach suctioning, which is what they did this week, but they will still have that stuff set up in there so they can continue practicing that. They will have NG tubes that they can practice inserting, as well as giving medications through the NG tube. And hold on, let me scroll down here to see if I'm forgetting something. I feel like I'm forgetting something. I guess that's it. That's it. So these are the instructions that I'm scrolling through here. So practice sterile technique. These are the instructions. The students, I made this available to the students, so they already have this with them or that they can access and bring with them. I want them to just practice sterile technique, just putting on the gloves. They can practice doing trach suctioning again, which they did this week, but they can also just practice like putting the gloves on and having different items out in front of them and what's sterile and what's not, what can they touch and what can they not touch, things like that. They can practice doing the rescue breathing more so that they get better with that technique. And then the NG tube, like I said, they will have the trainers there so they can practice measuring, putting the tubes down. And then they will have some of the tubes, and they'll have some syringes there and the pH strips so that they can practice checking for placement and then putting meds down the tube and flushing and all of that stuff. And then they've got some scenarios that they can calculate the rates for piggybacks, and then programming that into the pump using the drug library. And then they've got some scenarios up here not using the drug library so that they can practice getting comfortable programming those pumps both ways, so that they know how to do it with the drug library and without the drug library. And then they've also got some scenarios here for programming the primary infusions as well. I gave them a couple of just like regular, just programming primary infusions, but I also gave them some maintenance rates that they can calculate for pediatric patients as well. So they should have plenty of things to do in that station. As far as faculty assignments, I think work it out amongst yourselves if y'all want to have one person do the sim and one person stay in the skills station, or if y'all want to split that time amongst yourselves. You guys decide how you want to work that. I do want to have at least one faculty member in the skills station just to be there as a resource. There's no teaching that you have to do. This is all going to be student directed, but I do want to have faculty in there so that they can answer questions. We all know that the students are not comfortable with those pumps of all things. And so to be there just to answer questions or help guide them, I definitely want to make sure that every student is putting their hands on this equipment on the pumps, on the NG tubes. Like they're all touching these things and doing these things during this open lab time. Because I don't want these students coming back again after next week saying, I'm not comfortable with that. I haven't done that. We didn't do this. We don't know how to work it. After next week, there should be no more of that business. They should all have had ample time to do all of these things, and should feel comfortable doing these things moving forward after next week. So I want to make sure that we have faculty there, just to be able to see that everybody is doing what they're supposed to be doing in that time. There won't be anything that they need to turn in after next week. This is just going to be actually doing the hands-on stuff and participating in that simulation. And I think that's it. If y'all think of any questions, feel free to reach out to me. Thanks.